Hello, I am Joe Gellatly.
I'm Amanda Hepper.
Welcome to Medcurity Live. So we are going to continue a series where we've been talking through critical safeguards from the security rule that apply to HIPAA and healthcare organizations. So today, technical safeguards.
Right, that's
and
correct.
So really, as long as you have a policy against hacking, you're okay, right? Policy against getting hacked or viruses.
Yeah, just one-page policy.
Yeah, perfect, right?
Yeah.
That's all you need. As long as they know it's not allowed, it won't happen. No, okay. So what are some of the key technical precautions or safeguards that healthcare organizations are expected and actually required to put in place?
Yeah. So the first one that they talk about is access control in the rule. So, and that's exactly what it sounds like. So in physical safeguards, it's access to your building, right? So how do you prevent access? Well, not prevent access to your building, but protect your physical servers and workstations and the patient health or protected health information. But now, how do you technically protect your protected health information? And access controls is the first one. So it's exactly what it sounds like. So to prevent unauthorized access by a person or systems. Right? So systems can be attacking, hackers can use ransomware and all sorts of different things. So what are some ways or some methods for access controls?
So this is where we'd get into having appropriate credentials.
Yes.
Right? And password requirements.
Right.
Would fit under this.
Yep.
Are the password requirements, so some of these areas, we've talked about this with the other safeguards, some are required, some are addressable, right?
Yes.
So if they're required, we've got to follow the letter of that safeguard. If they're addressable, you can't ignore it, but you might be covering your bases in a different way, right? You're still ensuring that's not. So with, as we get into this, technical safeguards, there's plenty that are absolutely required, and user management, password management, I believe, is one where you can't ignore that one or leave that one out.
That's exactly right. That's exactly right. Automatic log-offs are another piece of this. So having a timing for when your system should either shut down or log out, so that somebody needs to.
Every physician's favorite thing, right?
Yeah.
It's that balance of productivity and workflow with security, and that's just a key example of that one. You have to find the right balance. Can't turn to the patient, turn back and log in every time.
Right.
But at the same time, can't have a workstation that's
sitting in a hallway, open
for an hour or two. Right.
Right.
Okay.
Right. Also, encryption and decryption are part of this.
So is that at rest or is that in transit or both?
I think that's at both, to protect it from being accessed. So if it is in transit or at rest, it's both vulnerable, right? So,
makes sense.
Yeah. So the next one is audit controls. And that is really monitoring your systems, to the audit trails for access to hardware as well as to software. So lots of electronic medical record systems actually have reporting in it that you can see who has made changes to patient charts and that type of thing. And so one thing that we do suggest in your policy is determine how often you want to run an audit check. In addition to, it doesn't have to be onerous necessarily, but you should spot check your systems to see if somebody's accessing patient charts that they shouldn't be accessing.
It's an interesting area, absolutely critical, that is not, they don't define how often you do it, they don't define how you do it. So it's an area where you end up looking for best practices according to the size of your organization, right? And the resources you have. It's not a daily, I'm going to check and look at what everybody did every day. But it's required that you assess what is the right level to have a reasonable handle on this, and then you put it in your policy, like you said. And then you log it when you do the audit. And then you keep those logs for 6 years. Yeah, that's right. So you keep so 6 years, as with so many things in the security rule, 6 years is the period of time which to keep those logs around in case of audit, to show that you've been following the policies and doing the due diligence required.
So you say what you're going to do, and you have evidence demonstrating that you did what you said you were going to do. Otherwise, if you don't have that evidence, it didn't happen, right? So the next one is integrity. So ensuring electronically transmitted ePHI is not modified without detection or inappropriately modified. So some ways to do that are back to encryption, making sure that your PHI is encrypted as appropriate. Then also having backups, ensuring that you have off-site backups if you need to restore is another way to protect the integrity of your systems in case something occurs. So this is kind of an odd one, I think. Sometimes it's not a real...
No, it's not an obvious solution to that, right? In fact, much of this is pretty understandable when you read through this at a high level for anybody in this role. But in the integrity section, it says make sure you have checksum and other types of validation technology, which is probably already in the systems you use. But it's one of those items you have to dig into a little bit to ensure that you do have that. And yet so critical because we're accountable to not just not letting other people view the data, but we have to make sure that data is solid and it's available when needed in emergencies, et cetera, and it's not being changed or messed with in any way.
Right. You want your medical record to reflect your issues.
That's always nice.
That's always nice, right? Yeah. So it's a way to protect that as well. The next one is person or entity authentication. So that is to verify that when you're logging onto the system that you are who you present yourself to be. So there's some ways to do that. So requiring something known only to that individual, such as password, something that the individual possesses, which would be like a token or smart card or something like that, or biometrics, or some ways to do that. And this would be what is appropriate to your organization and your systems too. So
yeah, that makes sense. Definitely somewhat of a maturity scale, right? So obviously got to have the password. But other things drive this too. So as you may be implementing biometric authentication for narcotics that require that to prescribe it, right? That's an opportunity to put that in place for your system setup as well, and then even use those biometric or fob type authentication systems to go to a one sign-on. This is it's a great area. Yeah, back to the physician workflow. This is an area where you can actually make it easier in some ways, and yet more secure if you look into the single sign-on using different types of tools like a fob. So, it's an opportunity.
It is an opportunity. The next one is transmission security. So implement technical security measures to guard against unauthorized access to ePHI that is being transmitted over electronic communications and networks.
So can you text PHI?
Not unless it's secure.
Right. Question that comes up, I mean, that comes up for sure because it's just a convenient way to work with other physicians, and it's I'm not going to say widely used, but it's very much still being used right now. So there are some solutions for text, for HIPAA secure texting, but just as a bottom line, pretty unequivocal. It's pretty clear that texting, just standard SMS testing, is not HIPAA compliant, and it is an opportunity. I mean, technically, that's a breach every time that's done. So that's an area to focus. Same, more widely understood. It's the same with email. Secure email is critical if you're reaching out to a patient or another party with PHI in your email. Right.
So portals are a great solution to that, right? To communicate back and forth. Encryption as well, which would help with the texting. So did a little research prior to this and looked at 2019 breaches to date. 25 million patient records have been identified as being breached in the first half of 2019. And the reasons for those, I think almost all go back to technical safeguards. So these systems were hacked, unauthorized access, which relates to hacking, of course, having servers misconfigured, server migration errors. One thing I want to say really quickly here is that I am a true believer in checklists, especially for IT, and to have a check and balance have somebody outline what your plan is to do migrations, have somebody responsible for each step, mark those as you go, have somebody else validate that you did those steps. Really can, it's widely used in healthcare, right? Checklists.
Mm-hmm.
And so IT, that's one thing you can do to help with this. Ransomware, phishing, a few phishing. And so users clicking on, in one case there was like 19 users that clicked in an organization that clicked on. Yeah, so they got all over. One other thing that's being talked about is dwelling time. So these hackers can get into your systems and you may not know about it unless you have somebody that is very keenly monitoring your network and what's going on. And so they just kind of sit and watch what's going on in your network until an appropriate time to, they get all the information they want. So
they may be already in.
They may be already in.
And a lot of what you've shared, we've seen scenarios where there's combinations, right? It was an employee opened an email, they clicked a link, the appropriate technical safeguards were not in place, they were able to, through one workstation, infiltrate the domain controller or other paths in, antivirus wasn't up to date. Just a combination of factors leads to ransomware, like you said. So they go and they encrypt the medical records, but then they're also infiltrating everywhere else. And so you may pay that ransom and have that data that you need decrypted, and you have access to it again, but you haven't actually kicked them out of the network, and so you're still at high risk. They turn around and do the same thing again. So so these each happen in isolated cases, but they also can be a combination of factors that put some of these organizations in a bad place.
Right. So that makes me think about your IT department and maybe a vendor if you have an MSP, managed service provider, making sure that you are partners with them and that you understand what the steps are in the event you suspect that there's been a breach or your system's been hacked, right? So you want to disconnect it from the network. You want to contact your IT department. You want to minimize any other potential spread of whatever is going on. And also, they want to preserve evidence. That's a really big thing, because if you don't preserve evidence, you wipe out everything. Well, then what happened? How do I know where they got? So, and then you may need to, identify if anything was exfiltrated, and then also at that point in time, you may need to bring in forensics to determine exactly what the infiltration was.
Yeah. A number of these sites have had FBI involvement very early, and they'll walk them through some of that, so you don't want to get ahead of that and damage the trail of what happened. And the FBI isn't there to, take any action against these entities. It's really to come in and help them figure out what happened, work backwards, and how do we protect our healthcare system, right?
Right.
So these are reasons why. So Medcurity has this risk assessment, risk analysis platform that takes you through what you're required to check on all these safeguards, right, on a regular basis. But these are the reasons we also provide and recommend at least penetration testing. We can do a full network scan where we can go through and look at all the workstations internally, all the vulnerabilities, because one point of access can lead to the entire network. So there's a lot of things to look at in that, and that's why we don't want to just check the boxes on a review of are these safeguards in place, but actually do regular scans with whatever partner you use to ensure that you know the state of your network and where to focus.
Very good point. So that's exactly where to start. To conduct the security risk analysis. Everything I have read, it's start with that. Figure out where you're at and be as brutally honest as possible in that security risk analysis. Define the gaps, develop a mitigation plan, make assignments and work your plan. Prioritize what your plan is, make assignments, and then monitor that, which is something that we can also help with. So. Good.
Well, good overview. Thank you.
Oh,
we get through your whole checklist?
I think we pretty much
Perfect. Okay.
Yeah.
Good. Well, thank you for joining us. And if you have any questions, any comments, throw them on the video or reach out to us anytime. Thanks for watching.
Yes. See you in a couple weeks.
Yeah. Yep.